No. See, I know he's not allowed to really. I think, well, technically he's allowed to say this. You just don't vape at all. Just don't vape at all. Put the vape down. You do not need it. You don't need it. It's not that important.
Nope.
Go pick up some water. If you really want to smoke something, go smoke some meat.
Perfect.
Smoke sausage.
Nope.
Smoke a steak.
Perfect.
Smoke bologna.
I'm not eating that. I can't eat that.
You ain't gotta smoke vape, cigarettes, weed, none of that. Well, I don't smoke weed personally,
What do you mean by that?
but there's some benefits to it.
Perfect.
Unless you run in the Olympics. Put the weed down. It's not worth it.
Or stop it.
You're welcome, you're welcome. Here's another glimpse in the life of Mr. Seldom. On a mission to heaven so he can tell me well done. He got all my secrets, he promised he never tell none. You're welcome, there's no other feeling like it.
Yo, what's up, everyone? It's Jamal Haki, channel dedicated to helping individuals unlock the will to conquer imagination. And if you truly believe in self, as well as the content being posted here on this channel, then we can indeed turn the you that's you into something more valuable. So we're back with another reaction video here on this channel. Again, I'm not going to make this channel a reaction channel, but I think in terms of my background and the direction where I'm going, I think it's important to kind of react to some things that I'm allowed to provide insight based off of being like a psychiatric mental health nurse, or just being in tune with psychology and things of that nature. And I think that will be kind of fun for the channel. But the main thing is still going to be like discussions, blogs, soapboxes, and just a whole slew of things that's pertaining to discussions and talking head videos, because those are things that I specialize in and the main thing I want to focus on.
Perfect.
But until then, there will be a few reactions on the channel. So if you got any recommendations that are health related, psychology related, or anything dealing with the mind, send them over my way. But until then, let's go ahead and see what we're going to be reacting to today. So today we're going to be reacting to what vaping does to the body. Now, I forgot the name of this YouTube channel. Again, you can see all the information below. Original video, link to the video will all be below. But again, I don't like smoking. Smoking, I don't tolerate it.
Nope.
Now, if you smoke cigarettes, I don't hate you, but I am going to look at you funny like, yo, you're smoking something that is very bad. It can kill you.
Make.
Now, I know people may be thinking, well, anything can kill you. If you eat too many donuts, if you drink too much water. Like, yeah, drinking too much water and eating too much donuts could actually kill you, but cigarettes can kill you faster and give you cancer. I never heard of a person getting cancer from eating donuts. Just saying. But let's go ahead and jump into the video. This is not pertaining to smoking, but it is pertaining to vaping, which is like smoking, and you get the point.
I beg your pardon?
What does vaping do to the body? Is it bad? And if so, how bad? And how does it compare to regular old cigarette smoking? Same, better, or worse? We'll answer all those questions and of course take out some real human lungs to help us with this discussion, as well as show some other organ systems that you may not know could be affected by vaping. So let's jump right into this.
So, okay, so the name of the YouTube channel is Institute of Human Anatomy. Now, again, if anyone's familiar with like anatomy and physiology, there you go. So this is the stuff we're going to get into. Now, is this still nursing related? Kind of, because you have to take anatomy and physiology before you can even get to, you know, your nursing program.
So as we get into this discussion about vaping, I just want to quickly say thank you to the sponsor of this video, Brilliant. We'll put the link in the description below, as well as talk a little bit more about Brilliant at the end of the video. But when it comes to vaping, or bringing vapor into the body, or cigarette smoke into the body, or just breathing in good old-fashioned oxygen, it's really important to understand the pathways in which those substances will travel, and therefore gives us an idea of how they can affect the body. So let's take a look at those pathways on the cadaver here. This is a sagittal cut through the head, and this will give us an idea
Sagittal?
of the
I know what that
upper
is.
airways. And if we take a look here, we
Alright.
can obviously see the nose, the mouth here. Now we can
Okay.
bring air in through the nose, and if it goes in through the nose, it'll enter a passageway called the nasal cavity. Now this septum right here is just dividing the nasal.
All right, so basically, he's about to say the nasal pharynx, right? The oral pharynx, the laryngeal pharynx, however you say it. Okay, cool. See, when the air goes in, right? Especially when you breathe in something through the nostril, through the nares, there's these things, what's it called? The turnbuckles, the tubercles or whatever it is, that allows the air to funnel through to warm the air up, right? To the body's temperature, so your body is then breathing in or allowing that air to come to room temperature for the body, make it more suitable, right? Am I saying that right?
Nasal cavity into right and left sides, but we can obviously bring air through there. We can obviously bring in air also through the mouth and the oral cavity. But both the nasal cavity and the oral cavity are going to end up going into the same place, this area that we refer to as the pharynx, but most of us just call it the throat. But as the vapor or the air moves down through the pharynx, we have to go one way or the other. There's this fork in the road. The posterior tube, often referred to as the food tube or the esophagus, that's not where this stuff's going to go. We're going to move the air or the vapor in to the trachea, which is the anterior tube or portion, which is pretty crazy that you guys can see. Even in a cadaver, you can see that, let me pull it up a little higher, that the trachea stays open, which makes a lot of sense because we're breathing all the time. So the body's created these little cartilaginous rings to keep the trachea or the airways open.
Interesting.
Where the esophagus, we're not eating 24 hours a day, at least hopefully not, and this thing can collapse.
I don't know, man. Some people eat 24 hours a day.
We're ending at the trachea on this particular cadaver, so I've got to show you a different dissection here of a right lung and, again, the trachea here. So let's just orient you. Here's the trachea. The air is moving down through there. But then when we get down...
Hey, have y'all ever seen a peep device on like a lung that look like that or something like that? And then the peep starts putting in the pressure to allow for the expansion of the alveoli and all the things, and then the lungs start looking like expanded lungs. Have y'all seen that? Y'all should look that up.
Down to the bottom here, we have a fork in the road. This is only the right half, or the majority of the right half here. It could go left to the left lung or right to the right lung. And when it branches here, we call these the bronchi.
I heard that.
As you can continue to see here, they just further branch into the lung tissue as different types of bronchi, or bronchus for singular. As the bronchi continue to branch, they get smaller, and we change the name to bronchioles. And then they go into these things called alveolar sacs made up of individual alveoli.
Go to the little grapes.
Now, that's your little anatomy lesson for how this air is going to go in. But the really important part of this is the alveolar sacs and alveoli, because those are the thinnest tissues within the lung, or the thinnest part of the tubing. Only 1 cell thick. And that's really important because that's where we exchange oxygen and carbon dioxide.
Yeah, gas exchange.
And the alveoli and the bronchioles tend to be the most affected when we're talking about vaping. So what exactly is vaping?
Okay, that makes sense, right? Because as you're breathing in, you breathe in O2, and then gas exchange occurs in the at the alveoli level, right? So when you have the circulation in terms of how blood is moving through the body, right? Blood goes through the right atrium to the right the ventricle, out through the pulmonary artery valve to go through the lungs, and it goes through the lungs, right? That deoxygenated blood goes through the pulmonary stuff to get to the lungs, to then go into the alveoli area, right? To allow for the oxygen to then get in contact with the deoxygenated blood to become oxygenated blood, right? Gas exchange, right? And then boom, that cycles through the heart, right? The oxygenated blood to then go through and then get the rest of the body. Boom.
Well, vaping started with e-cigarettes, which were originally designed to mimic regular cigarettes. However, the technology has dramatically changed over the last few years. These devices tend to now be larger, rechargeable,
you know what they say.
And they contain a cartridge that has a liquid inside. That liquid is then heated by being passed through an atomizer, which vaporizes that liquid and creates a vapor, hence the name
so bad.
vaping. But is bringing in that vapor to the human body a bad thing? Well, it definitely can be. You see, over the past few years, hospitals have seen an increase in patients with acute lung injury due to vaping. They've now termed this e-cigarette or vaping product use associated lung injury, or EVALI. And we'll use EVALI for the rest of the video.
Hold on. I never even heard this.
Coming in with symptoms very similar to pneumonia. But what they found is there was no infective cause to their symptoms. Meaning when they would do testing, they couldn't find a viral cause or a bacterial cause to their symptoms, but found that they all had these similarities and they had recently been vaping. So the idea was that something in that cartridge or that was being vaporized was causing some harm to the lungs. But before we get into what they think could be the products or the substances inside that cartridge, there were...
Wait a minute. So they still thinking about what the cause is, or they know what the cause is? We need to know, because you got people out here vaping 24/7, 365, vaping stay on their mind.
Or stop it!
Causing damage to the lung. Let me tell you a little bit about the symptoms that the patients were coming in with. Many of the patients would have fever, chills, and even that generalized icky feeling. Also cough, shortness of breath, and chest pain, and even hemoptysis in some cases.
That man got that Rona.
Being a fancy pants name for coughing up blood. And it makes sense if we're breathing something in that we could affect the lung tissue and have symptoms that would be symptomatic of a lung issue. However, up to 80% of patients with EVALI would have GI symptoms, meaning affecting the GI tract, and they would have things like nausea, vomiting, diarrhea, and just generalized abdominal pain. So the cause.
Interesting. Can we guess? Can we make a guess on this one? Can we make a guess? Okay, so if I'm guessing, right? So my guess is just like when you smoking cigarettes, there's some type of electrolyte imbalance. That electrolyte imbalance then will have an effect on the GI system as well. Just like you have people who have COPD, bronchitis, or emphysema, things of that nature, right? So they have like something related to COPD, which causes like a high level of CO2, and then like kind of like high level of CO2, a little bit lower pH, which allows the people to be like respiratory acidosis. With respiratory acidosis, there is some effect in the GI system, right? Or is that more metabolic acidosis? But we'll see. That's what I'm thinking with the vaping. It has some type of electrolyte imbalance, which then affects the gut. That's my guess.
Cause. What do they think is inside these cartridges, and therefore the liquid and the vapor, that could be linked or causing EVALI, and therefore the symptoms in these patients?
I want to hear it.
Well, the challenge is this isn't a highly regulated industry. So the ingredients that one manufacturer might use compared to another manufacturer might not be the exact same. However, they have found a lot of common ingredients in these substances, some of which include things like nicotine, which we know could cause substance dependence or be addictive. Also containing things like propylene glycol or glycerol. Those are known as humectants, which help moisturize the ingredients within the liquid in the cartridge. We also see things like tetrahydrocannabinol, which is THC, even CBD oils. And also they found vitamin E acetate. They can also include over 7,000 flavors, and some have found little traces of metal like tin, nickel, chromium, manganese, and arsenic. But out of all those ingredients, are some of them more problematic than others? Did they find any specific links to certain ingredients? And the answer is yes. So let's go back to that hospital example. When clinicians were going in and seeing these patients, they'd often observe tachycardia, tachypnea, which is a rapid heart rate, rapid breathing.
We know what that is.
Low oxygen saturation. They'd often get a chest x-ray or CT scan, which would show infiltrates in their lung, or what they refer to as opacities. And the clinicians are thinking,
that's my first time hearing opacities. Pneumonia.
And then they would go do cultures and see no bacterial cause, or they do viral panels and couldn't see a viral cause. And that caused them to think, what's going on here? And so in some cases, they would do this procedure called a bronchoalveolar lavage. A bronchoalveolar lavage
have I heard of this before?
It's when you take a scope or a fiber optic camera down into the respiratory passageways, going down into the trachea, And again, it would go down into these further airways, and you'd take the tubing or the camera within the tubing of the lung tissue or the bronchial tree to see if you could view things. Now, what they would also do is literally inject saline, which is kind of a salt water mixture, into those terminal airways, bronchoalveoli.
Wait a minute. Hold on, Playboy. Why would you? I mean, I know there's a reason to. I'm not saying I learned this in school, but you go inject some fluid into the bronchial saline.
Of course.
Hold on, I need. Well, let's hear this.
Alveolar lavage, so into the bronchioles and the alveoli, and then they literally suck it up, and then they would take that fluid and analyze it to see what they'd find. Again, they didn't find pathogens, but the majority of people with EVALI, they found vitamin E, acetate, and THC. So what do we do with this information about vitamin E, acetate, and THC? And since when is vitamin E a harmful substance? Well, it's typically not when we use it in lotions and creams and apply it to our skin or even ingest it. But remember, when we ingest and it goes down the food tube or the esophagus, that's going to be processed a lot differently than if it goes down the airway or into the trachea and down into the respiratory passageways and into the lung tissue. The idea is
we getting there.
This oily kind of thickening substance that coats the lining of the tubing or into the lung tissue that causes an inflammatory response. Is it interacting with the cells in another way that's causing a problem? Well, we don't know the exact mechanism yet, so more research is needed on that. However, because of the strong link of vitamin E acetate to patients with EVALI, the CDC has recommended that vaping companies don't use vitamin E acetate in their products, or you just don't pick a product that has vitamin E acetate.
No. See, I know he's not allowed to really. I think, well, technically he's allowed to say this. You just don't vape at all. Just don't vape at all. Put the vape down. You do not need it. You don't need it. It's not that important.
Nope.
Go pick up some water. If you really want to smoke something, go smoke some meat.
Perfect.
Smoke sausage.
Nope.
Smoke a steak.
Perfect.
Smoke bologna.
I'm not eating that. I can't eat that.
You ain't got to smoke vape, cigarettes, weed, none of that. Well, I don't smoke weed personally,
What do you mean by that?
but there's some benefits to it.
Perfect.
Unless you run in the Olympics. Put the weed down. It's not worth it.
Or stop it.
They're also recommending, unfortunately for those that like this stuff, that people don't use products that contain THC, again because of that link of how many people had it found in their bronchoalveolar lavage and had EVALI. I'm sorry to be the bearer of bad news. So how does it turn out for patients?
He ain't
with
sorry.
EVALI? If we're
That
talking
man ain't
about
sorry.
numbers, up until February of 2020, the CDC gathered data and they found 2,807 people were hospitalized with this.
Okay.
Out of those 2,807, 68 people died. If we do the math on that, that's about 2.4%.
That's
Now,
not
to
high.
be clear, that's not 2.4% of people who vape are going to die. That's 2.4% of people who get EVALI vaping. So based on those numbers, the majority of people will recover. Now, while they're being treated, many of them will get antibiotics, again, because of that close link to pneumonia. Until they can fully rule out pneumonia, they kind of do it for a precautionary measure. But again, once they confirm there's no...
So basically what he's saying is clients and patients coming in and then they are then diagnosed with some type of EVALI associated with vaping. They then will get antibiotics prophylactically until labs come back to then show that bacteria something's not there. So more than likely a culture will be taken. In between the culture being taken and the results coming in for that culture, the person will then be put on an antibiotic. Probably a broad spectrum is what I'm guessing. Or like a broad spectrum. It kind of covers the basis of anything, nothing too specific.
Infective pathogen, the antibiotics aren't going to do anything. And so we're talking mostly supportive therapy. Some clinicians have noticed that they've had some improvement with their patients with giving them anti-inflammatory steroids, which could help calm down the inflammation.
Which makes sense.
The majority
Some
of the
lung
patients, I
related.
should say, if they're in the hospital, are
Steroid.
likely going to get supplemental oxygen. How much that is depends on the severity. And then as the severity increases, we may be knocking on the door of things like ventilation. But the majority of patients will have a noticeable.
But then if you knock on the door of ventilation, if you not in a good hospital, you got VAP protocols, ventilator associated pneumonia. So you got to worry about that. So it's like you got pneumonia associated with vaping, but then you got pneumonia associated with ventilators. Ooh, we own it. We own it.
Will improve their symptoms within about a 2-week period. They may still have some residuals and need a few more weeks after that to feel like they're fully recovered. But again, over that 2 to 3 to 4 week period, you're probably looking at, I might feel like myself again. Now the long-term effects, we still don't know. And the last thing we need to talk about, how does vaping compare to regular old cigarette smoking or smoking tobacco? There is a general consensus in the medical community that if you had to pick between the two, smoking is worse than vaping. Now, we have a heck of a lot more data on cigarette smoking and its long-term effects when we compare it to vaping. We don't have a lot of long-term studies because it's such a new thing, and we're still even trying to figure out the exact mechanism of how vitamin E acetate and THC gets involved in EVALI and those symptoms. But if I gave you guys an example, let's say a clinician had a patient that says, hey, I want to quit smoking, and their patient says, can I try vaping instead? Now, the clinician would probably say, I'd prefer you to do neither, and we can use these other medications to help manage the nicotine dependence in another way, because these medications have a lot more research on their efficacy and safety. The patient's like, no, I'm not touching medications. These are your choices for me, clinician. What are you going to have me do? The clinician would say, okay, completely stop smoking and do vaping. There's a specific recommendation from the CDC that when patients...
No, man. Hey, listen, you come to my facility. I don't have one right now. But you come to my facility, you ask me, I'm going to give y'all the real. I'm like, hey, if you want to work with me, you gonna have to quit. Literally. No vape, no smoking, no nothing.
Nope.
I'm not playing those games. I don't want to run the risk of that. That's just me personally. Put the vape down. It ain't worth it. I guarantee that. Does it taste good? Is it benefit? No. Put it down. You don't need it.
Try to use vaping in place of smoking to not mix the two, because you just have to get the cigarette smoke out of there. And then when we use the vaping, there's this idea that we could eventually get to smoking cessation, and it's a lesser of an evil or lesser damage to the actual lung function.
I don't want no
What
evil.
about people who have never smoked and don't plan on smoking but want to vape or are currently vaping?
Ooh.
Well, the recommendation is, again, stay away from the vitamin E acetate and the THC. The perfect world scenario would be don't inhale any of these forms.
So what about hookah? What is
your
hookah
lung
again?
tissue. There's a huge increase in vaping in the younger population, especially junior high, high school kids, people in their early 20s.
People start vaping in middle school.
That this could be a gateway into cigarette smoking.
It is a gateway.
We have enough data to show that if you are vaping, you are more likely to try cigarette smoking, which again, we've just talked about, is known to be even more harmful than potentially just vaping. So I apologize to those who vape, who may think I'm being a negative Nancy or the bearer of bad news, but
no. So I'm gonna say it for him. You got to stop vaping. Put the vape down. Especially y'all younger people, please. What the hell do y'all don't need no vape in y'all mouth. Y'all need to be reading a dang book. Go pick up a book. How about this? Get all A's first, then think about vaping. I'm telling you, your mindset will be different. You'll be like, man, I would vape, but I'm focused on getting these A's.
That's a great idea.
Two of these organs, these amazing lungs that help us breathe and exchange oxygen and carbon dioxide.
That man was holding that up
so
like
we
a
should probably
taco.
Take care of them. But if you must vape, avoid vitamin E acetate, and it's probably best that you get THC from a qualified medical professional or through means that are consistent with your local state law.
But wait!
So, that pretty much sums up that video in a nutshell. Again, I just wanted to react to that. That wasn't like all like too interactive, because there was more things on the medical side, which didn't allow for a lot of input that I wanted to add. But for the things that I was able to add, I thought the video was interesting, number one. Especially learning about, I learned some things in relation to EVALI, and for people who have EVALI, people who have EVALI, right? One of the things or procedural things that they'll do for someone who is then diagnosed with that, either through nursing diagnosis or through an actual medical diagnosis. More than likely, it's a medical diagnosis because of the term EVALI. A nursing diagnosis will be like risk for infection related to vaping. Like, it'd be something like that. It wouldn't be like some type of a medical jargon term being used. So then the medical thing is then diagnosed, and then from there, a diagnostic procedure is then done to help the person with the EVALI. That's pretty much it for the video. Make sure you like, comment, subscribe. Just make sure, again, if you like the video or dislike, either is fine. Leave a comment below, share your thoughts, and then make sure you subscribe to the channel, hit the bell to be notified, and share the video for friends, family, and people you want to see win. This is Jamal Haki, channel dedicated to helping individuals unlock the will to conquer imagination. And if you truly believe in self, as well as the content being posted here on this channel, then we can indeed help the you that's you turn you to something more valuable. So that's it for the video. Peace out.
It's the act of God. I used to act the fool, but now I act in movies. Actually, I'm just making moves. We still making music. Tell you about my past to secure my future. I'm all in my bag. Flow like a computer. That's a humble brag.